I'm Daniella and I'm presenting on the quality of South African healthcare. And this topic was really interesting to me because I noticed that there was a really distinct division between the two separate classes, the wealthy and the impoverished, and the quality of the healthcare they were receiving there. So HIV and TB infects the population of South Africa more than anyone, not only in the continent, but the world. Human immunodeficiency virus is when your immune system collapses and makes you more vulnerable to any common diseases. But one of the most common diseases that it makes you more vulnerable to is tuberculosis. Tuberculosis, which will prominently infect your lungs, but can cause infections in many other organs of your body. And this will most likely cause death if you are immunocompromised. 18% of the population in South Africa was tested HIV positive, and that was really alarming to me because I read an article saying that the healthcare providers were the most at risk for contracting these two very deadly diseases. So in South Africa, the healthcare system is corrupt. There is lack of access and quality. And when the government found that there was such a lack of access, they began establishing more healthcare facilities. When they started establishing the healthcare facilities, there was lack of quality. So this becomes more of a threat to the population than a help. This also makes a lot of the population scared to seek medical attention if they need it because it could potentially make them more sick. Okay, this is also an example of why there is a lack of education, and not only the healthcare field, but in the population because of such high rates of the two most deadly diseases. When the new hospitals were established in impoverished areas where there was lack of accessibility, it was in areas where there was mostly black ethnicity. So this could have correlation to why the rates were so much higher in South Africa. Some of the causes of the wide gap of healthcare quality in South Africa and the reasons why the TB and HIV were so why there are such high rates in South Africa is due to drug overuse, misuse, prostitution, rape, abuse, lack of education, and a lot of gender inequality. So these are all consequences and also social issues which are due to the low-income areas. So in this book, Half the Sky, which we read this semester, we talked a lot about how the women in disadvantaged countries are experiencing lack of power and therefore being taken advantage of. So this is why when there are such high rates of rape and prostitution, that sexually transmitted diseases such as HIV and AIDS becomes so much more elevated. It is important for not only the government to step up for the education of the women in these countries to understand what these illnesses are, and with the increase of education, there is more of a rate for them to understand the change and implement the change. I think I skipped something. Okay. South Africa has the Freedom Charter, which is their version of the Constitution, and in the Freedom Charter, there is stated that there is free medical attention and hospitalization shall be provided for all. So this is not a practice. This is guaranteed but not practiced in South Africa. It's also the places that have been established to follow through with their free medical care is more harmful than helpful. These citizens do not have the peace of mind of getting quality health care when they need to be treated. And this, okay, sorry. So, and the country had non-existent healthcare until the 1990s when they realized the critical rates of the HIV and TB. The healthcare for Black South Africans is decreasing, and the wealthier areas are said to have 2 times more doctors and hospitals than in impoverished areas. So there is really a large gap in the healthcare quality and equality of where the hospitals are placed. Without the increased accessibility of education, there's no future possible for more reliable healthcare providers in not only the impoverished but the wealthier areas. In terms of the US, we don't really think of HIV or TB as a threat to our everyday life. The prevalence compared to South Africa is huge. in the U.S., the HIV prevalence will be like 1 million, will be around 1 million, and South Africa will be around 6 million. And the TB prevalence out of 100,000 people in the U.S., you can barely even see it, is going to be around 3 people, and South Africa will be around 900. So this is something that we don't worry about as a threat in our country. On a more personal scale, as a New York resident, before attending any schools, I had to receive mandated vaccines prior to attending, and that means that the people around you, and as well as yourself, are not going to be surrounded by as many illnesses as in South Africa, where there is not a mandated vaccine requirement. So this not only establishes a safer environment, but also establishes something called herd immunity, which is the idea that more people that are immunized and can receive immunizations have the less likely chance that there'll be further outbreak and decrease rather likelihood that the immunocompromised will receive the infections. The U.S. also has the Emergency Medical Treatment and Labor Act, which guarantees that anyone that walks into a medical facility, will receive treatment regardless of your pay, race, gender, citizenship, or any sort of social class. So this is nice to know that, I mean, obviously we are all very lucky, but if you were impoverished in the United States, there is an opportunity to pursue the same quality health care as someone that does have money. So I chose this topic because I'm a nursing major, and in the nursing field, we are tested, screened, and required above average vaccines to be able to practice in a hospital. This not only protects you, and it protects your patients from receiving any sort of transmission of diseases. If you're not suitable, if you do not pass any of these tests, you are not allowed to be in a healthcare provider. So it's really surprising that in South Africa, these people can go to hospitals and will have the threat of receiving a deadly infection. I realize how lucky I am to be going to Quinnipiac University to receive such a great education in the nursing school, and it's really awesome to know that I'll be able to use my ability to provide a safe and comfortable healthcare provider one day.
Questions?
I have a question. Are you at all worried if you when you go into the nursing field that you contract the virus?
If I what?
Are you at all worried when you go into the nursing field if you'll contract the virus?
I never really thought about that. I guess it's something that you kind of, I've never really thought about that. I guess it's something that you kind of know that you're going to get yourself into, but we're going into this knowing that, you know what I mean? So if that's something that you're nervous about, you're probably not going to go into the healthcare field, but that you are tested and screened and always updated with your own health.
You mentioned in the beginning of your presentation about the wealthy and poor, healthcare access for the wealthy and the poor. Did you find any information in terms of the middle class?
I think that a large part of my research found that there is a very small middle class. So if they do have money, they're more likely to go toward the private institutions. But that's what I thought was so interesting, that there is a very wide gap between the two social classes in South Africa.